over the last week or two, we've had a couple of phone calls in from listeners asking if we could potentially do a slot in relation to PCOS, which stands for polycystic ovary syndrome, which the people who phoned into us said essentially that there wasn't that much awareness regarding the condition, and if we could highlight it on the radio. So we got in touch with Sims IVF, and joining me on the line now is Karen Ferguson, Group Director of Nursing and Clinical Services at Sims IVF. Karen, good afternoon, and thanks for taking our call.
Hi there, no problem.
So PCOS then, in a nutshell, what is it, Karen, and how does it affect women?
So polycystic ovarian syndrome, often known as PCOS, it's one of the most common hormone-related problems in women. So PCOS, gets its name from a common ovarian ultrasound finding of multiple very small cysts in the ovaries that some women affected will have. It can be driven by insulin resistance in the body, where this is where our cells become less sensitive to insulin, which is the hormone that takes the glucose from our blood into the cells where it's broken down to produce energy. And high levels of insulin can increase these symptoms relating to PCOS. So the exact cause of it is unknown. However, it's thought to be potentially a genetic link, potentially an environmental link. And symptoms of PCOS can include irregular or absent menstrual periods. This in turn can lead to difficulty with conception or difficulty with fertility. It can often include weight gain, which is over 50% of those diagnosed with PCOS are considered to be overweight. Increased hair growth on the face or on the body, and some have issues with their skin and with acne.
OK, if we just pick up on some of those symptoms that you mentioned there, weight gain in particular, and also the increase in hair in certain areas of the body, as you say, including the face, maybe the arms, legs, stomach, back, whatever the case is, those can be, from a woman's point of view, very, very damaging, I'm sure, to self-image and can impact them hugely.
Absolutely, it can be very difficult. And I think the main, as your listeners have said, the main point of today and the main thing that we would like to get across is awareness for PCO. So women are not PCOS, so that women are not suffering in silence and are able to go speak to professionals about it, get a proper diagnosis and be able to get the treatment that they need, or sometimes it can be very mild treatments such as kind of diet and lifestyle modifications or some medication. There is a way of diagnosing PCOS. It can sometimes take a while. It can take multiple appointments from time to time. But basically there's like a criteria set out, and doctors should assess the woman, and they should have 2 out of the 3 kind of main symptoms which are relating to PCOS in order to get a diagnosis. So the first of that would be the irregular or the absent menstrual periods. This can mean somebody's not releasing an egg regularly through ovulation, which obviously in turn can lead to problems with conceiving. And then the second is what we already talked about, so the increase in what are called androgen levels, so that's like the male hormones. So this can be determined through the clinical and physical signs that you discussed, such as the increased hair growth, the oily skin, acne, thinning of hair, or alternatively this can be measured through hormone levels in the blood. And then the third criteria is the appearance of the actual ovaries themselves through pelvic ultrasound. So it is really important for diagnosis to be made and to be thorough so that patients and women can get the right treatment and can get the right support.
Do you think there's a bit of a stigma out there in relation to it? And, you know, as I say, the whole purpose of this interview today is to talk about it, to open up the discussion and to normalise it. But often women feel ashamed, they feel embarrassed about maybe what's going on. And for that reason, there's that little bit of a stigma.
Yeah, and I think historically that has been the case. Personally, I do feel like it is definitely improving. I've seen a lot of improvement in the last few years with women wanting to take ownership of their bodies, women wanting to take ownership of their health and wanting to know what is happening with their own health. So I think that we have seen a lot of encouraging increase in that, but there's still a long way to go. But part of the part of the problem is the awareness of, you know, if somebody's having these symptoms, if somebody's noticing these things with their body, is having the confidence to go to a professional to discuss it, which can often be very difficult.
Okay, in terms of treatment then, Karen, what is available for women who have PCOS? Is there a way to reverse it, or is it just a case of managing it?
It's pretty much a case of managing it, yeah. So it really depends on your specific symptoms, because there are kind of a variety of how this PCOS can present itself with women. So depending on your specific symptoms, there are some options to help manage. So lifestyle and diet, first of all. This can help manage some of the symptoms relating to PCOS. So a low GI and a kind of slow-release carbohydrate diet has been shown to help to regulate the blood sugars. So it's really important to aim to keep the blood sugar levels consistent. Ensure to include protein, whole grains, fruits, vegetables, and antioxidants in your diet. And things like resistance or weight training has also been seen to help with the resistance of insulin in your body. And then from a more medical point of view, medications such as metformin or myo-inositol can be given to help combat that insulin resistance, which in turn leads to the improvement of symptoms. But it's really important, of course, to speak to your doctor and complete the investigations in order to manage the symptoms, on a case-by-case basis. And then they'll be able to make a more appropriate referral from there if it's indicated. So if you're concerned about your fertility, for example, or if you're not having regular periods and this is concerning you or you're worried about it, there are more kind of fertility-related treatments available.
Absolutely.
Oral medications or injections that can be given to promote ovulation initially before moving on to more intensive or invasive treatments if they were required. So there's kind of steps to take initially, but it is really important to speak to a professional first of all, or even the likes of a dietitian or something like that, just to try and gain an understanding of your diagnosis initially.
And as I mentioned from the outset, you're from Sims IVF, and we'll talk a little bit about the fertility side of things in a moment. And there are some messages coming in to us, Karen, and I know that everything is kind of dealt with on a case-by-case basis, but I just want to put them to you. If you can't answer them, you can't answer them. That's fair enough. In terms of the medication, how long might that take for maybe people or women to start seeing it working? Generally what kind of a course of medication are they looking at?
Yeah, so it can, with the oral medications such as metformin or myo-inositol, it can be a few months before you see a difference. Obviously with lifestyle and diet on top of that, it will all kind of help. But if patients are, and I know it very much depends on age and other factors within their life, but for example, if somebody is trying to conceive, or maybe perhaps they've been trying for a year or up to a year and it hasn't worked, and they feel like they really want to kind of get things moving, then that might not be the kind of first step that they're offered. It may be worth a try, but it really depends on kind of age and other kind of factors within their life and what their aim is. Is it fertility or is it just generally lifestyle?
Okay, there's another one in here as well asking in terms of an endocrinologist that they heard maybe they should go and visit an endocrinologist. This woman is just wondering what would they do or what's the difference between, say, taking the medication and what the endocrinologist would do?
Yeah, so an endocrinologist would be a good idea, and that's normally they can get a referral from their GP, or if they're going to a fertility centre, rather than kind of just bypassing the actual root cause of a woman not being able to conceive, for example, rather than just bypassing it and going straight to the fertility medications. It's a better idea to go to the likes of an endocrinologist who can have a more in-depth look at a person's hormones and a potential hormone imbalance there, in order to try and kind of solve the issue from the root cause, and then in turn try and help with the symptoms more kind of before just going straight into IVF or IUI or different types of fertility treatment. Okay. So an endocrinologist is often a good idea, and we would often refer from Sims to endocrinologists if we needed that opinion as well.
And finally, there's a message in here from Mairead. She says that she was diagnosed with PCOS when she was 30. She was concerned she would never have children, but happily went on to have 2 little darlings, she says. So really that means, and kind of highlights that often when a woman gets diagnosed with PCOS, the fertility and all that goes with it is the first thing that goes through their head. am I going to be able to have children? But the message is that there is that possibility still, absolutely.
Absolutely, yeah, there is, absolutely. It's one of the associated kind of side effects or something within the PCOS sphere, but there is definitely a lot of patients who conceive naturally. A lot of patients go completely undiagnosed with PCOS, at the beginning. So absolutely you can still conceive naturally. But if you are concerned about your fertility, it is something we would recommend even just to have the investigation, just to kind of gain an understanding of what's going on with your body, but absolutely not necessary straight away. Some people like to kind of try naturally for a certain amount of time, or even go to their GP, have a blood test to see that they are ovulating fairly regularly in order just to help them and increase your chance and just see where they stand with it all.
OK, well, I think it's been a very important and worthwhile discussion on the show this afternoon. Thanks so much for joining us. Karen Ferguson, Group Director of Nursing and Clinical Services at Sims IVF. You can get more information on their website, social media as well. Thanks, Karen, for joining us, and thanks for all those messages coming in to us as well on 0833 97 97 97. Now, going back